Okay, so I'm going to tilt you back just a little bit.
That's fine.
Okay.
That's fine. I'll take a nap.
And Sherry sprayed your nose.
Yes.
Got you numbed up. So I'm going to give you a couple little injections towards the back end area. This is a topical gel that we put back inside there to kind of help numb it up a little bit. Trying to get that stuff way back down there. So the next thing is the injection, and that goes right into the skin. So you'll probably feel a little bit of a prick, and then it's a little bit kind of a burny, and then it goes to sleep. Some of this stuff drips down the back of your throat, and it kind of gives you this sensation that your throat's closing off, but it isn't. It's doing real good. This cotton just has the same kind of medication in it that the other stuff did. It just kind of goes back there a little bit farther. Good. So that's right back there where I'm going to be working, back in the back of your nose. So there's some little nerves that come out of there that control a lot of these secretions in your nose. And that's what we're going to try to zap and try to get them to be less crazy. This takes a lot longer than the procedure, the actual procedure. That's good. Yeah. So this is the little device, and it's got these little electrode things on the end of it right there. It just kind of heats up the tissue underneath. It preserves the outside membrane, but the deep membrane down inside there is what gets kind of cooked, like in a microwave oven sort of a thing. I'm going to take these little cotton things out of here. Okay, so this is the back of her nose right in there. I'm going to go back in here in this area, way back in the back, and that's where we're going to zap those nerves down there and in the back of that turbinate right there. Same thing over here. She's got an opening to her sinus there, so probably.
Sinus opening.
Yeah, and we're going to go up here. Let me move this turbinate out just a little bit, Jill, with the freer. Hear some cracky noises?
Yeah, I do.
Yeah, that's all okay. All right, let's go ahead and start opening here. That's her little sinus ostia. That was not a surgical opening. She just came with that one. Yeah. And here's a little probe here. Just slide it under this turbinate. Go right back here. So this is actually the posterior nasal nerves come out of this area, and this is heating them up and just basically kind of killing them.
So they don't secrete so much mucus.
Yeah.
Oh no, I've had it all my life. My grandma had it, my mom had it. Just drips to where it just
Drives you crazy.
Yeah, I go through so much tissue, it's not funny.
So those beeps are the little heating going on. You're doing great. You're an excellent patient. So that's called an accessory ostia, this thing right here. A big opening right there, yeah. Sometimes that's a problem because they get secretions that come out of their nose, and they come out the normal opening, and then they go back in the accessory opening, and they just keep going. Yeah, I call that circus movement. Okay, get a little bit more gel here. Almost done on this side. There we go.
That one's
Doing
done.
okay?
Mm-hmm.
All right.
Is that one done?
That one's done. Okay, we're getting close here. A couple more little spots. Okay, that looks good. So this is the back of her nose right here. That's the eustachian tube opening. This is where your adenoids live, right in here. And up in here is where we did those lesions along here to try to get those, to block those nerves that are coming out of there.
See the white.
That's it. So afterwards, she just starts rinsing, just saline in her nose. And that kind of keeps things clean and keeps the crust from building up so much. And we check it again in about 2 months and see how you're doing.
So the bottle looks like this. It's this size. You're going to fill to the fill line with boiled or distilled water. You are not going to use tap water, ever, never. And then you will put one of these little packets in. So here's the fill line right here that she'll fill it to. And then
and you go like this and squeeze. The water goes up and comes out the other side, or it can come out that side and you do it this side.
It's 2 or 3 times a day, starting tomorrow. Do not irrigate today.
Just don't use tap water.
Yeah, no tap water.